Sulfasalazine is a medication used to treat ulcerative colitis, a bowel disease that causes symptoms such as fever, stomach pain, diarrhea, and rectal bleeding. It does not cure the condition, but it helps decrease these symptoms and increase the amount of time between attacks. Sulfasalazine works by reducing irritation and swelling in the large intestines. Additionally, delayed-release tablets of sulfasalazine are used to treat rheumatoid arthritis, helping to reduce joint pain, swelling, and stiffness. Early treatment of rheumatoid arthritis with sulfasalazine can also help prevent further joint damage, allowing patients to do more of their normal daily activities. This medication is used in combination with other drugs, rest, and physical therapy for patients who have not responded to other medications. It is important to take sulfasalazine as directed by your doctor, typically with food or after a meal, and to follow the dosage and timing recommendations carefully. When taking sulfasalazine DR, it's important to follow your doctor's instructions. Take the medication after meals with a full glass of water to prevent stomach upset. Your doctor may recommend a slow increase in dosage when starting treatment. The dosage is based on your medical condition and response to treatment, and for children, it's also based on weight. If you're taking delayed-release tablets, be sure to swallow them whole and not crush, chew, or break them, as this can increase the chance of stomach upset. It's important to drink plenty of fluids during treatment with sulfasalazine DR, unless otherwise directed by your doctor, as this can help prevent kidney stones. Take this medication regularly at the same times each day to get the most benefit from it. It may take 1 to 3 months before you notice any improvement in symptoms for the treatment of rheumatoid arthritis, so be patient and consistent with taking the medication. And don't forget to tell your doctor if your condition does not improve or if it worsens. If you experience stomach upset, nausea, vomiting, loss of appetite, headache, dizziness, or unusual tiredness, it's important to talk to your doctor or pharmacist. Sulfasalazine doctor may cause your skin and urine to turn orange-yellow, but this is harmless and will go away when you stop taking the medication. If you notice delayed-release tablets of sulfasalazine in your stool, let your doctor know so they can adjust your treatment. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the risks of side effects. However, it's important to watch for serious side effects such as changes in hearing, mood, or kidney function, as well as signs of low blood sugar. In rare cases, sulfasalazine may cause very serious allergic reactions, blood disorders, liver damage, nerve/muscle problems, and infections. Seek medical help right away if you experience severe headache, skin rash, mouth sores, swelling, trouble breathing, chest pain, signs of infection, severe tiredness, or other concerning symptoms. This is not a complete list of possible side effects, so if you notice anything unusual, be sure to contact your doctor or pharmacist. Before taking sulfasalazine, make sure to inform your doctor or pharmacist about any allergies you may have, especially to sulfa drugs, aspirin and related drugs, or mesalamine. It's important to discuss your medical history, including any intestinal or urinary blockages, kidney or liver disease, blood disorders, asthma, severe allergies, or recent infections with your doctor or pharmacist before using this medication. Be cautious when using this medication, as it may cause dizziness, especially when combined with alcohol or marijuana. Avoid activities that require alertness until you can do them safely. Also, limit your alcohol intake and talk to your doctor if you are using marijuana. It's important to limit your time in the sun and to use sunscreen and protective clothing while taking this medication, as it may make you more sensitive to the sun. Seek medical help if you get sunburned or have skin blisters/redness. If you are under 18 years old, consult a doctor before taking this medication, as it is similar to aspirin and may cause harm if taken during chickenpox, flu, or any undiagnosed illness, or after receiving a live virus vaccine. For males, this medication may temporarily affect fertility, so be sure to discuss this with your doctor. During pregnancy, only use this medication if clearly needed, as it may lower folic acid levels and increase the risk of spinal cord defects in the baby. If you become pregnant while taking this medication, contact your doctor immediately. This drug can also pass into breast milk, so consult your doctor before breastfeeding. When taking sulfasalazine DR, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with sulfasalazine doctor include digoxin, folic acid, methenamine, and PABA taken by mouth. Additionally, it's important to note that sulfasalazine is very similar to mesalamine, so it should not be used with mesalamine medications taken by mouth. Furthermore, this medication may interfere with certain lab tests, such as urine norepinephrine levels and liver function tests, potentially causing false test results. It's crucial to ensure that lab personnel and all your doctors are aware that you are using sulfasalazine doctor. In terms of the optimal timing for taking sulfasalazine DR, it's best to follow your doctor's instructions and take the medication as prescribed. Additionally, the daily dosage will vary depending on your specific condition, so it's important to adhere to your doctor's recommendations for the most effective treatment. If you suspect an overdose and see serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, get in touch with a poison control center as soon as possible. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. Symptoms of an overdose may include persistent vomiting, severe stomach pain, extreme drowsiness, and seizures. If you experience any of these symptoms, seek medical help right away. It's important not to share sulfasalazine DR with others. While taking this medication, it is important to have regular lab and medical tests, such as complete blood count and liver/kidney function tests. Make sure to attend all medical and lab appointments. It's best to consult your doctor for more details on these tests. As for the daily dosage, sulfasalazine doctor is usually taken with food or after a meal to reduce stomach upset. It's important to follow your doctor's instructions and take the medication exactly as prescribed. The optimal timing for taking sulfasalazine doctor can vary, so make sure to discuss the best time to take it with your doctor. Sulfasalazine doctor is used to treat certain inflammatory bowel diseases, such as ulcerative colitis and Crohn's disease. It works by reducing inflammation in the body. Be sure to take the medication as directed and do not stop taking it without consulting your doctor. If you happen to miss a dose of sulfasalazine DR, take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and continue with your regular dosing schedule. Avoid taking a double dose to make up for the missed one. It's important to take sulfasalazine DR at the same time each day to ensure its effectiveness. It's important to store sulfasalazine DR at room temperature, away from light and moisture. Make sure to keep it out of reach of children and pets. When it's no longer needed or expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush it down the toilet or pour it into a drain unless you're specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.